let's just kind of check range of motion for you real quick. I'm gonna have you stand up. In terms of just hinging, let me know anything that bothers you. Just kind of hinge forward as much as you can, see how you do with it. Nice neutral spine. Good. Do you feel the pull? No. Okay. Good. All right, so let's test you a little bit more. Now just kind of drag. Just pretend like you're getting a bar right here and just kind of drag down as much as you can. Feel the hamstrings a little bit if you get there.
Yeah, so here I start to feel.
Okay, so if you were to train, okay, probably ideally let's do just stick with dumbbells. Yeah. You know, so you're not bending way too much down. Yeah. To get the weight for the time being, in terms of gripping the bar. So with dumbbells, you just go down because you feel fairly safe in this range, right? Yeah. So we'll just use a dumbbell, drag down to where you feel the hamstrings. Yeah. Come back up from there. So that's doable, yeah?
Yeah, that's definitely doable.
Okay, good. So squat wise, go ahead and take the shoes off. Yep, go ahead and just kind of do a few. Again, we want to get to a point where you're comfortable. Yeah. You know, you feeling it already, or?
Yeah, so at this point, this is where I feel it. So
okay.
I just have to go down. Yep,
so I want to give you a cue. Brace the core. Just take a nice deep breath in, just like powerlifting style. Brace. Go as low as you can, comfortable. Yeah. And just get to the point where before you feel it. Yeah. So even if you feel it, come back up just slightly. See if you're okay on that part.
Right there.
Right there? Okay. Where you feel it more is on right here? Yeah. Okay, so higher. Yeah. Yep. More on the paraspinal QL. Okay, gotcha. Whew. Okay. Gotcha. All right. Okay. So next test I want you to do, go ahead, have a seat right here. Okay, so what you're gonna do is use your hands, grab the bottom end of the seat, lean forward and see if that irritates you. And pull yourself down.
Yeah, wow. Yeah.
That bothers you?
Yeah.
Okay. All right, now sit straight right in the center, pull yourself in, see if that does it.
Pull myself in as in
like just pull yourself down. So it's axial load compression. How's that? That's okay?
Yeah, that's okay.
Okay, so lean back a little bit, pull yourself in.
Yeah, I feel
a little bit, but it's not as uncomfortable. Okay, so what we got going on is probably an anterior flexion problem, where now this, obviously our spine kind of tucks this way a little bit, but when you're pressing forward, that's uncomfortable. Yeah. Okay, next test we're going to do, let's have you face down on the table for me. Yep. All right, I want you to lift this side up. Yep. Not bad. This side. Actually not bad neither. It's actually pretty good. So extension wise, you're pretty darn good. Okay, same thing. I'm just gonna check again. Yeah. So this time around, brace your core and lift your right leg first. Awesome. No pain?
No pain.
Good. Same thing on the other side? Same thing?
Yeah.
Not bad?
Yeah, not bad.
Awesome. Let's have you on your back. So let's have you extend coming up. Flex your legs up. Anything? Slight pull?
Yeah.
On the left side?
Yeah.
Okay. Same thing on the other leg. Let's have a quick reset. Straighten your leg up, toe point towards your nose, and then lift. A little bit of a struggle, but it's actually pretty decent. How is that on your back?
It's not bad.
Okay, good. Same thing on this side, on the opposite side. Hear a little crack. Not bad, right?
Yeah.
Okay, good. So relax, I got you. A little stiff on the hamstring, high hamstring. Pretty good rotation here. Actually, yeah, that's pretty decent. But it does feel like your legs are a little tense. Get right there. Good. Okay. Glutes a little tight. Doesn't want to go too much. Hips don't lie, apparently. Okay, yeah. Any pain?
No.
Okay, good. So hamstrings on this side. That's probably not too happy. Right here, how are you feeling?
Still, yeah.
Not bad?
Yeah.
Okay, good. Not bad.
Feel like a pretzel.
Like a pretzel. Just a little bit. So, how's right here? Feel a little tight on this? Yeah. Adductors. Ooh, okay. So, we can definitely improve on this. Feel it on the glutes?
Yeah, a lot.
Yeah. So, pretty good internal. External is pretty good. Alright, so I'm gonna have you stack, relax. Oh man, okay, this is definitely tight. Yeah, okay, gotcha. So, if you're just kind of able to feel it when you're doing this, your hips is obviously not giving you the space to move. So a lot of it is probably coming from the hip muscles, okay? Otherwise, leg muscle tension wise is only thing I truly notice in terms of passive flexibility wise, that hamstring is pulling a little bit on this left side, okay? Let's have you face down. the true test. Let's get you to squat. Better? Still feel it a little bit though, yeah. You got a little bit better range. Go ahead and do sit to stand from the table. That feels good. True test. Let's go more of a sumo style. Just slightly drag down, feel the hamstring, come back up. Good. All right, bring your legs a little bit closer, shoulder width apart, so it's more of a squat pattern. All right, go ahead and do so. Keep it closer to you. Keep it closer to you. Yep. I can see your lever is kind of shifting forward, so that's going to put more strain on that low back. Just literally think about if you're deadlifting with a bar, you want to keep it nice and tight, almost as if you're dragging up. Good. All right, so I want you to feel a little bit more confident, so keep going down. I want you to shift your hips out just a little bit more. Pretty good there? Good. Now bring it up towards you into a goblet. And just go ahead and squat down as far as you're comfortable with. Nice and big brace. Good, good, good. So when you went down, were still more here or
higher,
up here?
Higher, yeah, up there.
Okay, gotcha. Okay. More up here or still in this?
There.
Okay, yeah. Okay, so I am going to give you a prop. Sit to stand, bring it nice and close. That's good there.
Yeah.
Up. How's that?
I feel it, but it's manageable. Yeah.
Okay, so we want to prop it up. This is the highest it goes right here. Okay, I want you to do tap and go.
Okay.
How's that?
Manageable.
Okay, good. Let's go 10 reps. Good.
I'm gonna do like 5. That's okay.
You got 5 more in you.
It's painful.
Good. All right, so let's go quick stretch here. So pigeon right here, just more on the elevated space and just trying to drop yourself down and turn, so you're stretching that. Yeah. How's that? Just getting that right around this area. Good. So with this one, you can play around with a bench.
Yeah.
So if you're at the gym, no longer than a minute for warm-ups, okay? For post-workout, 2 minutes max, okay? So when it comes to stretching, so you can do something like that on an elevated surface, like a box or something like that.
Yeah.
Or if you can, the bench, you just place your leg onto the bench. You can put it on an incline and play around with the angles. Obviously, the lower it is, the more of a stretch you feel.
Yeah.
So play around with that one. So homework wise, that would be your number one. Okay. The child's pose to cobra, that would be really good for you. I would do probably like 6 reps to 8 reps. All right. So just focus on half of it, regular pattern, just down and back, and then half of it focusing on the side to side.
Okay.
And once you feel fairly balanced, half of it regular, 2 that way, 2 that way. Okay. Make sure you just move throughout the day. Okay. Because that's going to ultimately what tells your brain you're healing, you're moving, you know, you're capable to do so. Okay. Always have a ball around if possible. So I recommend utilizing something like a softball or something similar to a lacrosse ball. At the very least, tennis ball is too soft, especially for the glutes area. So for you, I would just start off on the wall first. So if you're just hanging out, you can just press it on the wall, watch TV, whatever. That's something you can do, you know. Or even if you're, well, studying or whatever, you're looking at the paper. Yeah. So basically, start off like same thing when I showed you for the chest. You can do that on the glutes. Okay. Again, warm up wise, no more than a minute. Regular treatment wise, no more than 2. Set the timer if you have to. Ideally, you work with breath work. So deep breath in, exhale. That allows you to sink into the ball a little bit better. Okay. And if you're ready, okay, you can always bring that leg up a little bit. Not that flexible, but this will help expose that muscle a little bit and help you get into the position a little bit better. So it kind of brings that muscle out a little bit and for you to sink in, okay? Whew, I need it. Yeah, so this would be fantastic just on a maintenance level. Because at the end of the day, this might give you a temporary relief for the time being, you know, maybe the next 24 hours or so. This is important homework that you need to do to upkeep until I see you the next time, right? Also, let's just focus on those first, okay? I do have the other video, the short clip up. So cat-cows is really good if you can implement just to, once you did your child's to cobra, go into cat-cow. So that way you're working on the full spine, okay? And then the thread the needle, the thoracic rotation, especially that I find that for you right here on the thoracic spine is a little stuck, especially if you have long hours of studying. Very important to hit, okay? Let's start with that. And then in terms of workout, ideally if you can, let's see, we can set something up on Sunday. I just want to make sure you are able to perform your movements, you know, on a safe manner. If anything, we'll, you know, regress to a point where we know you can do it, still making gains, okay? yeah, in general, let's start with that, and then obviously, you got my number if you need me. Yeah.